Hi, here at Regenesis we take a complete sort of global approach to your health and wellness and beauty. So we're going to talk about things that we do, things that we can do for ourselves daily, monthly, quarterly, and yearly. So I use a pyramid to kind of visualize it. So let's talk about skin.
Yes.
Okay, so this is your skin, and you have stuff that you have to do for your skin every day, like wash it, okay, products, okay. Then what else do? You wash it, you put some sort of serum,
Making sure you're hydrating.
hydration, okay, and then the most important, SPF. Okay, like a good sunscreen that blocks UVA, UVB, something zinc based, which is a barrier protection. So that's for your skin, right? What about, this is daily, okay? This is monthly, quarterly, yearly. So let's just do skin first. So we're putting, products on our skin, we're washing it, we're taking care of it every day. We don't go to sleep with our makeup on. We use good products. We use products without any parabens or, and really good quality physician strength products, which actually make a difference. Now monthly, what can you do monthly for your skin? You can do facials, and you can do all different sorts of facials. You can do, if your skin is dry, like after winter, you can do a hydration facial. If you have acne, getting extractions and getting your pores cleaned, that's important. If you're trying to do, something for your, for your skin to help your collagen, maybe getting some sort of laser treatment to stimulate that collagen would help. Now, what can you do quarterly? Quarterly, you can do treatments like microneedling. And then depending on the time of the year, you can do different things. Like for example, it's cool right now, the sun hasn't come out, it's not summer. This is a good time to do IPL, which is intense pulsed light, which is going to help bring up, it's a laser treatment, but it's going to help bring up all that pigment, and then that pigment sloughs off. So that's a no downtime laser, you can do that. Right now this is a great time to do it. So you have nice porcelain, clear skin. And then what else could you do? You could do clear lift, which is another laser. Again, no downtime, and that's really great for melasma. It's also really good at getting that collagen regenerated. Then what do you do yearly? Now yearly you want to do treatments like a more intense resurfacing treatment, like the CO2 laser, or you could do the erbium laser, or you could do there's a lot of resurfacing lasers that we have. Now resurfacing lasers have downtime, but it's also going to get rid of enlarged pores, fine lines and wrinkles, and it's also going to help that collagen come back. So we lose about 1% collagen every year after the age of 30. So I'm 45, so I've lost 15% of my collagen. So that's a lot of collagen. and the more damage you do to yourself, like if you smoke, or if you're in the sun a lot, or if you just have a terrible lifestyle, you drink a lot, you party a lot, you're going to lose more. So the people who don't take as good care of their skin, is going to look worse, right? So this is kind of an idea of like how you would do this. Other things you can do yearly are filler. Okay, so the filler is hyaluronic acid, and it's replacing that lost volume that we're losing because we're losing collagen, elastin every year. We're aging. So that filler is something you do yearly. Quarterly, another thing you can do is Botox or any sort of neurotoxin. So Botox is going to help freeze those muscles, not necessarily freeze, but not let them move too much.
Kind of relax them a little.
Relax them, yeah. So you're not getting those wrinkles, more deep set wrinkles. So you can do it as a preventative thing. A lot of people in their 20s and 30s are even getting Botox now. And you can use it for migraines, you can use it for like, I clench my jaws, so I put a little Botox in here. Lots of ways you can do that. So other things you can do monthly or even quarterly are peels, chemical peels. And there's all sorts of chemical peels. There's some that you can do monthly, which have very little downtime, just gives you a nice little glow. We include that in a lot of our facials. Some peels, which are deeper, you can do quarterly. Like there's more intense resurfacing peels. So that's kind of an idea of how you can take care of your skin. So whenever we do see a patient for skin and for a consult, we talk about all this. So if you go and get some Botox done or you get a peel done, but you're not taking care of your skin on an everyday basis, then that's going to not make your skin look as beautiful as it could. So we see a big difference if you're doing these things daily.
Definitely.
So
that makes sense. And a lot of people, and these are, they really work best when done together, and everybody's a little different. So
yes.
I think the best thing to do if you're questioning how you can better your skin is just to come in, get a consultation, and you can take it from there. But the daily tips are definitely useful.
There's lots of people who have other things going on, like rosacea, which is so underdiagnosed and so common. There's acne. It could be hormonal. It could be, in teenagers, and it could be you can have it hormonal acne, around the chin and stuff, even when you get older. So there's a lot of stuff like that, and that also depends on like how you eat, which vitamins you take. So we would recommend those things. We would change those things too.
Definitely.
And that comes into your daily routine too. Like taking a dry vitamin A will help with your acne. Taking a collagen supplement will help boost up your collagen. Doing things for rosacea, like reducing inflammation and taking a lot of vitamin C helps with rosacea. So these are all things that can help.
Yeah, no, these are great tips. So if you have any questions, guys, let us know.
We kind of do this with even your health. So, the same way we look at skin, we look at your health and your overall wellness too. So there's things you can do for your health.
Definitely.
Daily, monthly, quarterly.
So when it comes to the body, for example, we exercise every day. We eat well. We take our supplements. We hopefully are wearing SPF if we're going to be exposed to the sun a lot. But there's also other things that we can do for our body as well. A lot of these, the laser treatments and contouring, there's a lot of techniques we can use to kind of just help those processes along. And
again, it depends on the time of the year. Right now everyone's getting ready for summer, so we're going to be wearing less clothing. And so you want to get your body contouring in, and you want to lose weight if you've gained some weight during the holidays, and get healthier. I think daily your goal should be to think about how you treat your body so that you can live longer, live healthier, and have a better quality of life and look good. So that's something you should be doing daily. But monthly, also, you should be kind of reassessing how you've treated your body that day.
Definitely.
that month. Like, some intermittent fasting would be a good thing, or something like that to help regenerate. It doesn't just help with weight loss, but it helps with regenerating your cells and anti-aging. Now, quarterly also, I have a lot of people who have chronic diseases like diabetes and heart disease and things like that. Quarterly, they should be checking in with their doctor.
Definitely. So we do regular wellness here as well. Like if you need physicals and stuff like that, we can do blood work and lab work, which a lot of people don't know. Yes. But that's also great. And we have nutritional IVs, which is another thing.
So that's also something you could do monthly. IVs. So like some of this sort of interrelates. Like for example, glutathione. Okay, now you can get that monthly or even every 2 weeks. That helps your skin greatly. We use that a lot for melasma, for reducing inflammation, just making your skin look better, feel better. Daily, the vitamins or supplements. I'm big into that. So all my patients are on vitamins and supplements
of
some sort. I don't think our diet is perfect 100%, and our environment has so many ways in which it can damage us, cause free radical damage. So we have to counter that.
Definitely.
Then the IVs also, you can do different IVs based on, what's going on. We had somebody who just recovered from surgery, so we did a post-op IV to help reduce inflammation, help healing. and help pain.
Mm-hmm.
If you've had like a weekend of a lot of partying, you can come in and get an IV to help you recover, hydrate yourself, get some vitamin C and B vitamins.
Definitely.
There's IVs for immunity. There's and the reason why I like doing these IVs is because none of our guts are particularly there's a few of us who are really healthy, have great gut health, but most of us don't. We eat out, we eat on the go, we don't necessarily have a well-rounded diet.
Mm-hmm.
So our absorption of minerals and vitamins may not necessarily be 100%. You're putting it all in an IV and giving it to you in an IV bypasses your gut.
Definitely.
So you get that really great response. Also, there's a lot of minerals and vitamins that you cannot give in high doses because it can cause, gut issues, diarrhea, or irritation, like vitamin C, for example. You can take about 1 to 2 grams orally, but anything more than that is going to give you diarrhea. So we get up to 20, sometimes 50 grams of vitamin C, depending on what we're trying to treat in an IV.
Wow, that's great.
So we do definitely recommend testing before we do all that, but we can do that. So there's a lot you can do. Medicine is amazing, and anti-aging medicine is amazing. So, keep that in mind. You want to look at a whole, complete approach when it comes to your health and beauty.
Definitely. Awesome. Great information. Thank you.